Welcome to this demo of the AIMS Caseload Tracker, a web-based behavioral health registry for collaborative care offered by the AIMS Center at the University of Washington. The AIMS Caseload Tracker is a secure, HIPAA-compliant online registry designed for behavioral health teams working in collaborative care or other integrated care settings. It is intuitive and easy to use, simplifying the sharing of important patient information across the team. All aspects of the registry are designed to support clinical best practices based on the latest research evidence around effective care. For more than 25 years, the AIMS Center's registries have been used at over 400 healthcare organizations across 35 states. The AIMS Caseload Tracker organizes information about behavioral health episodes of care to help providers track visit dates, symptom scores, and systematic caseload review dates. It minimizes double data entry to include only the essential items for caseload prioritization and decision-making support. The AIMS Caseload Tracker helps providers track depression, anxiety, and PTSD symptoms using the PHQ-9, GAD-7, and PCL-5 scales. Pediatric practices can also track anxiety, depression, and ADHD symptoms using the SCARE, the SMFQ, and the Vanderbilt scales. The AIMS Caseload Tracker is web-based, so it can be accessed anywhere with an internet connection. There are different account types for behavioral health providers, psychiatric consultants, clinic supervisors, and data analysts, allowing each to perform their specific jobs. PCPs continue to work solely in the EHR and don't typically use the Caseload Tracker directly. Learn more about prices and licensing on the AIMS Center's website or email us at aimstech@uw.edu.
To get started, I'll log in as a behavioral health care manager. The AIMS Caseload Tracker makes it easy to find patients that are due for an appointment, which is a key element of caring for an entire population, not just whoever walks in the clinic that day or is requesting treatment. This is a list of reminders, which is the landing page for behavioral health care managers each time they log in. Care managers use this page to prioritize their outreach efforts, making sure that patients are monitored regularly and stay engaged in treatment. Care managers receive a reminder to contact new patients within 7 days of enrollment for an episode of collaborative care, then reminders to check in every 2 weeks during patients' active treatment status. Patients who are preparing to complete their episode of collaborative care can be put into relapse prevention plan status, which drops the frequency of these visit reminders to every 4 weeks. Care managers use the date of the last contact attempt to help them decide when to reach out again. The AIMS Caseload Tracker helps care managers and psychiatric consultants track clinical outcomes across a population of patients by clearly presenting the information they need to make systematic changes in treatment for patients who are not improving. The Active Patients Caseload List page displays one row for each patient on the care manager's caseload. Let's review this information, starting on the left side of the screen. The care manager uses the flags column to identify patients that need attention. 3 flags are available to select. The yellow flag indicates a patient that should be discussed with a psychiatric consultant during systematic caseload review. The red safety risk flag can be used when patient safety issues would be a consideration for the care team. The blue flag can be custom labeled for any purpose that would make the AIMS Caseload Tracker more useful in your program operations. The status column displays information about whether each patient is newly enrolled, in active treatment, on a relapse prevention plan, or deactivated. PHQ-9 scores are displayed in the next set of columns, with the baseline score, which is the first score recorded in the current episode of care, alongside the most recent score. Organizations can also choose whether to track GAD-7 and PCL-5 scores for anxiety and PTSD symptoms. Each score is coded to indicate symptom severity, and you can hover your cursor over any score to reference the date it was collected. An asterisk indicates the score is outdated and the symptom measure needs to be re-administered. Organizations can also choose whether to include pediatric scales, the SCARED, SMFQ, and Vanderbilt scales are available to track pediatric depression, anxiety, and ADHD symptoms. The next group of columns contains information about dates of service, the date of initial assessment, that is, the first care manager visit, the date of the most recent follow-up with the care manager, the date of the most recent psychiatric case review, and the date of any relapse prevention plan. This page is interactive, so you can select any date to learn the details from that visit, or select the Add icon to record a new contact. The actual encounter notes will be written directly into the EHR, as usual. The care manager will only record the contact date and symptom scale scores into the AIMS Caseload Tracker. The next columns display the total number of care manager sessions each patient has had so far, right next to the number of weeks in treatment. Taken together, these give a sense of treatment intensity. The Minutes This Month column displays how many minutes of service have been delivered for each patient during the current calendar month, including both care manager contacts and psychiatric case review sessions with the care manager. This information can be used to optimize activities for billing. Organizations can choose whether to track minutes depending on whether it's useful for their program. Deactivate is the final column on the screen. Care managers should deactivate patients when treatment is complete or has ended for another reason. The patient will be removed from the active caseload list, but can be re-enrolled into a new episode of care if they return to treatment in the future. You can sort the caseload list by selecting any of the column headings to bring highest scores to the top, or bring oldest visit dates to the top, which can be very useful when a care manager has a large caseload. This report can also be run for other providers, which can help members of the care team cover for each other during vacations or leave. Now that we've reviewed how the population-level reports can help prioritize and manage caseloads, let's explore how this information is entered. Care managers enroll patients by indicating the clinic location, enrollment date, and some basic identifiers like medical record number and date of birth. Organizations can choose whether to include the race and/or ethnicity question. Once the enrollment form is completed, care managers will briefly document each time they have a patient contact or make a contact attempt, whether it's in person or over the phone. During the first session, they enter an initial assessment. To record the initial assessment, fill in the visit date and the scale scores that were collected. Select which scales you'd like to appear in the contact below. Your selections will carry forward to subsequent contacts for this patient. To fill in the scale, select each answer item, and then the total score is calculated for you, or you can enter the total score directly. In the Psychiatric Consultant section, select the checkbox to indicate that you'd like to discuss this patient with the psychiatric consultant during systematic caseload review. This activates the yellow flag on the caseload list for this patient. You can add any comments or questions into the notes box for the psychiatric consultant to review. Finally, select where the session happened and how long it took, and save the form. Subsequent contacts will be recorded as follow-ups using a similar template. Keep in mind that the care manager must record the narrative portion of the note, as well as the symptom scores into the electronic health record, which is the legal medical record for the patient and accessible to the entire primary care team. Care managers should record a relapse prevention plan, or RPP, when a patient is in maintenance phase and is ready for less frequent follow-ups. Once an RPP contact has been entered, follow-up reminders will decrease from every 2 weeks to every 4 weeks. When the patient has completed treatment, is no longer receiving care, or has been referred to specialty care, the care manager can deactivate the patient to remove them from their active caseload list. Patients will still appear on a separate list of inactive patients and can be brought back into treatment at any time by re-enrollment into a new episode of care. Next, let's review features that facilitate collaboration between the care manager and the psychiatric consultant. The psychiatric consultant can log in to access information collected by the care manager, including patients that are flagged for discussion, and can use the caseload report to sort and prioritize patients that should be discussed. Either the care manager or the psychiatric consultant will record the date each time a case review happens for any patient. The yellow flag on the caseload list will automatically turn off once that's done. The AIMS Center strongly recommends that the psychiatric consultant have direct access to your clinic's electronic health record, or EHR. Reviewing the patient's complete chart enables the psychiatric consultant to make better informed treatment recommendations and to route those recommendations directly to the primary care provider. The psychiatric consultant should always enter their assessment and treatment recommendations directly into the EHR so that they can be acted on by the patient's PCP. Once patient contacts have been recorded, there are several reports that allow providers to dive into an individual patient's record and track progress. This is the clinical dashboard, which contains all the information that has been recorded for a patient in one place. Care managers can monitor whether the patient is due for an appointment, review graphs of symptom scores over time, and access a summary of treatment, including both care manager contacts and psychiatric case reviews. Next, let's look at some of the reports and population management tools. The Caseload Statistics page is a powerful report that summarizes how providers or clinics are doing in terms of both service delivery and patient outcomes. It is designed to help you identify areas of improvement for your program, to promote use of symptom monitoring tools, promote healthy caseload turnover to extend the reach of your program, and to identify patients that are not improving as expected and may need a psychiatric case review. Reviewing all patients that are currently enrolled in your program, you can compare caseload size, number of visits, average session length, use of scales for symptom monitoring, effective use of the psychiatric consultant's case review time, average symptom scores, and remission, response, and improvement rates. The report compares numbers between care managers, or you can run it by psychiatric consultant, by PCP, or by clinic location. The COCM quality metrics are a set of measures that give insight into key process and performance data. The metrics were carefully designed to reinforce the key elements of collaborative care best practices. By referencing these metrics over time, providers and managers can assess program trends to identify areas for improvement and areas where successes should be recognized. The metrics include caseload reach, engagement, measures completion, patient outcomes in each area, and psychiatric case review. The completed episode statistics report summarizes information about all patients that have completed treatment. It can help practices understand the reality of how long patients stay in treatment and how many direct contacts they have during that time. It also gives visibility into the total number of patients served and overall patient outcomes. This information is designed to help your program assess provider engagement, capacity, and productivity, and to establish an overall summary of the proportion of patients that have achieved their goals under treatment completion. The Depression Remission or Response report calculates whether each patient is meeting the HEDIS Depression Remission or Response metrics. The HEDIS DRR includes 3 metrics. For each patient, we display whether they've met the follow-up PHQ-9, depression remission, and depression response metrics for the calendar year. If your organization chooses to track minutes in the registry, the monthly time tracker report is available to summarize the number of minutes of service for each patient for the current month and past 12 months. This can be used as a reference when billing the COCM codes or to demonstrate for audit purposes which services were provided. Note that if your clinic plans to use the AIMS Caseload Tracker to record minutes for billing, then only billable minutes should be recorded. This report does not distinguish between billable or clinical time and non-billable or administrative time. It simply displays all the minutes that are recorded.
More information and guidance on billing strategies can be found on the AIMS Center's website at aims.uw.edu. AIMS Center staff are available to assist your site with the licensing process and help your team get started using the AIMS Caseload Tracker. A library of self-directed training materials for the AIMS Caseload Tracker is available online, including a comprehensive user guide and many video tutorials. It typically takes each person about 1 hour to learn and practice using the registry. You can purchase the AIMS Caseload Tracker for your organization by following the licensing instructions on the AIMS Center's website. If you have any further questions, please email us at aimstech@uw.edu.